Good morning, dear listeners. Today we continue our podcast series with our last mushrooms, therapeutic mushrooms. This is the topic of my book, Healing with Micotherapy. And the last mushrooms, last but not least, is one of the most important mushrooms, and is the Trametes or Coriolus versicolor. So usually called turkey tail in English name, but it's also known as Coriolus versicolor, and is one of the most studied and clinically most important mushrooms used for the treatments of different types of cancer. Now, the researchers have been focusing on these mushrooms for its anti-tumor properties, and particularly two pharmacologically active protein-polysaccharides complexes of both proteoglycans, and that is PSK and PSP. So these have been evaluated in large-scale clinical trials. So such compounds have been shown to be very immunotherapeutic in cancer treatments, especially if combined with conventional treatments and with no adverse effects or toxicity. Polysaccharide-K or PSK is the first approved medicine derived from a mushroom and is one of the most widespread and widely accepted for the treatment of some types of cancer, particularly in Japan. This has shown impressive results in patients with gastric, colorectal, esophageal, nasopharyngeal, uterine, lung, breast cancers, and also in leukemia. So used in together with conventional treatments, whatever that may be, the PSK has significantly prolonged the survival of patients, improved immune system reactivity, and that is thanks to the increasing number of immune cells, and it's also reduced the side effects of radiotherapy. And this was a study in the year 2000. Other clinical studies have shown that PSP, Polysaccharide-Peptide, prolonged survival in patients with esophageal cancer and enhanced response immunity in 70 to 97% of patients with gastric, lung, ovaries, and endometrium cancers. So, above all, the PSP peptide reduced the side effects of chemotherapy, increase chemotherapy therapeutic effects, and improve the quality of life in more than 70% of patients. That again is a study of the year 2000, maybe not so recent, but still valuable. I'm sure there are many other studies much more recent, but in any case they all prove the same. Coriolus versicolor has significant antiviral properties and anti-cancer properties. It can help people with immunodeficiency virus, HIV, herpes simplex virus, and to a minor, it's also hepatoprotective, protects the liver, and it can also help with chronic fatigue. So just to close and to give the main therapeutic application of this mushroom, Coriolus or Trametes versicolor, is cancer. Other applications are viral infections such as HIV, herpes virus, and also chronic fatigue syndrome. And the key components are Polysaccharide-K and Polysaccharide-Peptide. So that is all, also for these mushrooms. And if you want to have more information, you can get the book Healing with Micotherapy, and all mushrooms are described in various details. Thank you all for now, and we will continue with other podcast series in the very near future. Thank you.